Welcome back to Doodle Nurse. This is where we simplify complex concepts into an easy to understand visuals. Today, we will be discussing pharmacokinetics, which is the study of how drugs move through the body. A helpful way to remember this process is through the acronym ADME. A stands for absorption, how drug enters the bloodstream. D is for distribution, how the drug travels to the tissues and organs. M is for metabolism, where the drug is broken down, mainly in the liver. And E is for excretion, which is how the drug is eliminated from the body primarily through the kidneys. Understanding ADME is very essential because it helps us determine how effective a medication will be, how long it stays in our body, and how to dose it safely. Before we begin, though, please note that this content is for educational purposes only and is not intended as a medical advice. Always consult your healthcare provider and follow your facility protocol. Let's get started. On this slide, we are looking at pharmacokinetics, like I mentioned earlier. This is what describes how drugs move through our body. A simple way to remember this is the acronym ADME, which stands for absorption, distribution, metabolism, and excretion. Let's start with absorption. This refers to how the drug enters our bloodstream. For example, oral medications are absorbed through the stomach and small intestine, while the intravenous or IV drugs, they go directly into the bloodstream with 100% bioavailability. One concept here is the first pass metabolism, which means that the drugs are partially metabolized in the liver before reaching the systemic circulation. Next is distribution, which is how the drug travels from the bloodstream to the tissues and organs. Drug distribution is affected by protein binding, especially the albumin. Only the free or unbound drug is active. We have to remember that. Additionally, lipid-soluble drugs can cross into the brain and fat tissues, while water-soluble drugs tend to remain in the bloodstream. The blood-brain barrier plays an important role in limiting which drugs can enter the central nervous system. Moving on to metabolism, this primarily occurs in the liver through the CYP450 enzyme system. There are two phases for this. Phase one, which modifies the drug through processes like oxidation, while phase two, it conjugates the drug, making it more water soluble for elimination. Some drugs are prodrugs, meaning that they are inactive until metabolized into their active form. Finally, excretion is the removal of the drug from the body. The kidneys are the main route eliminating drugs through the urine, while drug can also be excreted through the bowel, goes as feces, and then lungs, sweat, and saliva. The concept of half-life determines how long a drug stays in our body. In patients with renal failure, drugs can accumulate, leading to increased levels and potential toxicity. In summary, ADME helps us understand how a drug is absorbed, distributed, metabolized, and ultimately excreted, which are essential concepts for safe and effective medication management. This slide, we will be focusing on how drugs cross the cell membranes, which is a key part of the drug absorption and distribution. There are three main ways that drugs can cross a cell membrane. The first is through a channel and pores. These are small openings that allow water-soluble drugs to pass through. However, this method is limited because only very small and specific molecules can use these channels. The second method is through a transport system using carrier proteins. These carriers move specific drugs across the cell membrane, and sometimes this process requires energy in the form of ATP. This is especially important for drugs that cannot pass through the membrane on their own. And the third and most common method is the direct penetration of the membrane. In this process, the lipid soluble drugs dissolve into the lipid layer of the cell membrane and pass through easily. On the other hand, polar or ionized drugs cannot cross this way, which limits their absorption. A key concept to remember is like dissolves like. So this means that lipid soluble drugs cross membranes more easily, while water soluble drugs have more difficulty. So overall, only lipid soluble, non ionized drugs can directly cross the cell membranes, making this very important concept when predicting how well a drug will be absorbed. Understanding these mechanisms also help us determine how quickly and effectively a drug can reach its target site. On this slide, we will be focusing on drug distribution, which is how a drug moves from the bloodstream to tissues and organs, like I mentioned earlier. One key factor affecting distribution is the protein binding, especially the albumin. When a drug is bound to protein, it is inactive. And like I've mentioned earlier, only the free or unbound drug is active and able to produce a therapeutic effect. Another important concept is the lipid versus water solubility. Water soluble drugs can move into tissues such as the brain and fat, while water soluble tend to remain in the bloodstream. A major structure involved in distribution is the blood brain barrier, or BBB. This barrier protects the brain by restricting what substances can enter. Only lipid soluble drugs can cross the blood brain barrier easily, while water soluble drugs cannot pass through, which limits their effects in the central nervous system. So, when thinking about drug distribution, it is important to remember that only free drug is active, and lipid solubility determines whether a drug can reach certain tissues, especially the brain. Understanding these principles help us predict both the effectiveness of a drug and its potential side effects. This slide, we will be talking about the drug metabolism, which mainly occurs in the liver, as I've mentioned earlier, and is a very high yield concept. The liver uses a group of enzymes called CYP450 enzyme system, and that is to break down drugs. One of the most important enzymes to remember is the CYP3A4, which is the most commonly involved. Genetics can also influence how these enzymes function, affecting how patients respond to medication. Drug metabolism occurs in two phases. Phase one involves modification of the drug through the processes such as oxidation, reduction, and hydrolysis. This phase can either inactivate the drug or sometimes prepare it for the next step. Phase two is called conjugation, where the drug is combined with another substance to make it more water soluble, allowing it to be easily excreted by the kidneys. Another important concept is the prodrug, like I've mentioned earlier. These are medications that initially inactive and become active only after being metabolized in the liver. Several factors can affect CY450 activity, and this is including age, genetics, liver disease, and drug interactions, of course. Drug interactions are especially important because we have enzyme inducers such as phenobarbital and carbamazepine, which increases metabolism, which can decrease drug levels. Enzyme inhibitors like grapefruit juice and macrolide antibiotics, they decreases metabolism, which can increase drug levels and can also risk for toxicity. So overall, metabolism determines how long a drug stays in our body and how strong its effect will be, making it very essential for safe medication management. Now let's talk about drug excretion, specifically how the body eliminates drugs through the kidneys. The process mainly happens in the nephron, which is the functional unit of the kidneys. There are three key steps involved. These are the filtration, reabsorption, and secretion. First is filtration. When blood enters the glomerulus, where drugs and small molecules are filtered out from the bloodstream and into the nephron. This forms the initial filtrate. Next is the reabsorption, or what we keep. Important substances like water and electrolytes are reabsorbed back into the bloodstream. Some drugs may also be reabsorbed, especially if they are lipid soluble. Then comes secretion, or what we toss. Additional drugs are actively transported from the blood into the tubules to be eliminated. This step helps remove drugs more efficiently. And finally, the remaining substances move through the tubule and are excreted as urine. So overall, drugs move from the blood, goes through the filtrate to the tubule, and then urine, leading to elimination from the body. Understanding this process is important because kidney function directly affects how long drugs stay in our body and helps us guide safe dosing. And that wraps up our overview of pharmacology concepts with Doodle Nurse. We've covered how drugs move through the body with pharmacokinetics and how they affect the body through the first pass metabolism, and which are the key concepts that are essential for safe and effective patient care. If you found this content helpful, please don't forget to like, share, and subscribe to stay updated with more simplified, high yield nursing content. And as always, as a reminder, this content is for educational purposes only and is not intended as a medical advice. So please consult a healthcare professional and follow your facility protocol. Thanks.